Type the Q&A questions in. So I hate to ask because you normally ask.
Socks. I was just reminded I forgot to ask you about your socks.
I
Put it in the chat feature.
have good ones.
Matt likes cool socks. Let's see the socks.
I was excited for these ones, actually. I pulled these out of the I pulled these stockings out of the stocking. That's terrible, huh? I shouldn't.
It's good enough. It's post-Christmas humor.
Okay, all right. So these ones are actually lobsters.
Oh, I love lobsters.
And they're like big lobsters. And like all the way, like just all over. And I'm like, I was seriously, at first I was looking at them like, what is that? I'm like, oh my goodness, it's lobsters. And you know what's funny? I learned this about lobsters. They're cooked lobsters because lobsters aren't red until you cook them. Isn't that true?
That is true.
And
they're
so
sort of a blackish brown color, or sometimes they're blue.
Or sometimes they're blue. So I have cooked lobsters on my sock.
There we go.
But wouldn't it be funny if you saw socks of lobsters, but they were just brown, right? Brown lobsters. We would think that's odd, but anyway. Oh, so today we're not talking about lobsters, although we might.
But we may work our way back to lobster later.
We might at some point. So I'll start out a little bit with something that's been on my mind. I think it's been on lots of people's minds. But because I will often contemplate, like, what should we at least open up with? Because, we never know where we're going to go when we get on here, and we get all sorts of fun questions. But I've talked before about the concept of gracious assumptions. I've talked but what's really been on my mind is the amount of empathy and compassion that is missing. And I do not wish to dive into a political discussion, but I do, as an observer, when we look at the extremes of anything, we typically will see, like in our political spectrum, we have a lack of empathy and compassion on both the extremes. And so if you look at like conflict that occurs in our relationship, well, if the conflict is painful enough, it puts us into an extreme place, right? If the conflict is painful enough, it puts us, or scary enough, it puts us into an extreme place where we feel like survival is on the line, right? Our survival is on the line. And so our need to fight comes up, and oftentimes maybe even our own shame comes up, our own embarrassment comes up. And when our shame, our embarrassment, when our fear, when this feeling to fight or to flee or to freeze, when these feelings come up, empathy and compassion leave us. Because if you think about it, if something is dangerous, if something is scary, if something's painful, it's not about like, oh, let me sit with this and figure out how to be compassionate, figure out how to be empathetic. It's like, no, I got to get out of here, or I got to make this pain stop. So empathy and compassion leaves us. And where there is an opportunity for conflict resolution, right? Where is attachment born? You guys have heard me talk about this before. It's in the repair of conflict. So here we have a conflict occurring, and we have an opportunity for compassion and empathy. Now, compassion and empathy does not mean I need to agree with you. Compassion and empathy means I understand you. I understand your rage. I understand your hurt. I understand your pain, right? Whatever it is. And I see it. I hear you. Now, I may completely disagree with the way you're choosing to express it. I might agree with how you're expressing it, but I'm not going to agree to the terms to change it, for instance. But connection can still occur, understanding can still occur. Now, obviously, it takes ultimately two people who are seeking to have empathy and compassion towards each other, where connection ultimately occurs and relationships and trust are built. So you can have empathy and compassion. I will use um, the example of a child. Sometimes it's difficult. So I can build a relationship with a child. I can build trust with the child, and I can have empathy and compassion and not agree with what they want. And I can calm a child down, and they're still upset that they're not getting what they want. And I'm like, well, I know that it's upsetting, but it's going to be okay. And the child can still just be upset, but there's connection, there's understanding, and there's calm, and they don't ever get what they want. And they really don't understand where I'm coming from. And some of that is they just don't understand. They lack the capacity. And I think sometimes adults can be that same way. They're not going to put in the time, the effort. Maybe they lack capacity to understand where the other side might be coming from. And so sometimes there are people with different issues going on where they don't have that ability to have compassion and understanding. And we have to decide, am I going to stay in this relationship, or am I going to engage this relationship? Or am I just going to accept that this relationship, this is the capacity at which this relationship is limited. And ultimately it's up to each individual to figure out what that looks like and what's right for them. So I've talked a lot about that on here. But what I'm going to push you to do, if you're on here listening, you're trying to figure out what are you going to do with this information? And so learning how to come out of that emotional extreme and how to practice having compassion. What you might want to do is you could go to any of the recent political things, whether it's the protests on the Capitol, I'll call it that, or protests that have occurred around the country for other reasons, police brutality, whatever it might be. And no matter what position you normally take, try to have compassion and empathy. Try to give yourself an experience to say, hey, do I understand why they take the position they take? Whether there is a political pundit, I think is what they're called. Listen to somebody who you don't typically listen to, that you don't agree with, who you might think is filled with hate or lacks accountability, whatever it is you might feel there, and practice. Why would they feel this way? What upbringing might they have? And learn to have compassion and empathy and understand where they are coming from a healthy perspective. Those types of exercises in practice help build our emotional tolerance. So another way we do this is we can go to 12-step and we can listen to other people in the 12-step program, and we can hear their plights, their difficulties, and we can gain emotional tolerance. The hardest person or people to gain emotional tolerance with are the people who are closest to us, the people we have the most to lose with, be it our children, a spouse, a lover, whatever it is, a brother, a sister, a parent, somebody that's going to be the hardest person that we have to have in our life to maintain emotional tolerance with. And so you're looking for other opportunities of conflict and trying to learn how to stay connected and have compassion, have empathy, even if I don't agree. So I thought that's what I would open up. Scott, I imagine you've got great questions. We may even have a question in the Q&A already.
We do have a question in the Q&A. When you said that there's a lot of empathy, we'll get to that one. When you started your discussion about, there's a lack of empathy and compassion kind of in what's happening in our world today, which I certainly agree with. The German word Schadenfreude, are you familiar?
Oh my gosh, I love that word.
Yeah, taking pleasure in the misfortune of others.
Oh my gosh, right?
There's so much Schadenfreude in the world. Only the Germans would come up with that word, by the way. That's the only language in which there is a single word for taking pleasure in the pain of others.
Yes.
I'm not ripping on German people, but
Yeah, I was gonna say the way you said
it's
that was like only German
interesting
people.
that,
Come on, Scott.
yeah, I know. I'm backtracking. But it's a great word, and I just see so much of it.
It,
People are,
it,
somebody
I
on one
love
side of the fence will get COVID, and everybody's like, "Oh, I hope they die," and I'm like, "No."
right. No, I love that that word exists. And I love that the Germans came up with that because the truth is that exists for all of us at some point, whether we want justice or fairness or whatever. Like when we feel so depleted, we almost have this idea. And if you look, you can look at every culture, including the German people. Every single one of us has had wrongs done to us at one time or another. We've been wronged, we've been hurt, we've been whatever. There's injustice, and so all of us, when in a way to seek. In a way to seek joy, in a way to seek pleasure, we often get mixed up in the idea of, well, maybe if the people who have wronged me suffer, I'll feel better. It just doesn't work. Anyway, so I love that you bring that up. So keep going.
Yeah, no, that was kind of what I was thinking. Is Schadenfreude feels good in the moment, but it doesn't really do me any good. I mean, I'm an Indianapolis Colts fan. I love that the New England Patriots did not make the playoffs this year, but it doesn't make my team any better or worse. And it doesn't make my enjoyment of my team any better or worse. And I'm like, why do I really have this ill will toward them? you know, it doesn't do anybody any good, and they don't know who I am, and they don't really care that I have ill will toward them. I'm having an argument with someone who doesn't know I exist.
Right.
So I did want to bring that up, and then I wanted to reiterate the other point you made. Kind of the last point was that the toughest people that to emotionally tolerate are the people that we're closest to. And I think and you hit it on the head. That's the conflict that hurts the most. That's the conflict that hurts us the most, and is much more likely to put us into that fight, flight, freeze mode.
Oh, totally.
Yeah. And the conflict, I mean, it really does go to the lizard brain, the fight, flight, freeze part of the brain. And that's our response. And, in the world, we're seeing a lot of fight right now. And in relationships, we see fight, or sometimes we see a lot of freeze too, I think. What do you see more, fight, flight, or freeze in relationship conflict?
That honestly, I don't know that I could give you a definite answer. I think for every single person, it depends on the circumstance. I think all of us can have a fight response in one circumstance or a freeze response in another. I mean, the one that was most surprising to me was coming to understand the freeze response. Because I think a lot of times we talk about fight or flight, and those make the most sense. But the freeze response is, man, the word I want to use is really damaging, because I'll give you an example. It's a heavy example, but if I have a person that comes in to see me, for instance, that maybe had a sexual abuse experience, they will often say that they froze. And one of the questions we might ask somebody after a sexual abuse experience, and by that it could be somebody who was raped or whatever else, we often ask, well, what did you do? Right? Or why didn't you do this? Or why didn't you yell or scream or punch or run away? Or, and it's that freeze response that I may be getting off on a tangent here, that I found the most fascinating, because it's a survival response, but because it looks like inaction, we then blame ourselves. So freeze is like a dangerous one for the psyche, because fighting makes sense, running makes sense, freezing for a lot of us doesn't make sense. So it messes with our psyche that, well, maybe it is my fault, and maybe whatever else we begin to tell ourselves because we didn't know what else to do. We just held still. We froze. So
Yeah, that's
I don't know
yeah.
that that answered your question.
Yeah. Well, I can't even remember what my question was now, but
What we see most.
oh, okay, yeah. But yeah, the freeze response, particularly because you and I both talk to people all the time who have suffered sexual abuse, and that particularly childhood sex abuse, the freeze response is the response. I mean, freeze, leave the body, don't tell
Oh,
anybody.
freeze, dissociate. And if you think about it, the concept there is, at least I believe, based on what I've learned, is almost like, let me hold still, let me freeze, because who wants to engage with somebody who appears to be dead, right? Like it's that if you appear to be dead, oh, this thing's dead, we're going to leave it alone, right? Don't want to eat something that's dead. I mean, I don't know, that's the evolutionary idea, right? Or who would want to engage with somebody who's non-responsive sexually, right? And so it makes sense to freeze, except you're not dealing with somebody who's thinking in a healthy way. You're not dealing with somebody who's engaging healthily sexually. And so non-responsive means they're there, if that makes sense. And so they just keep doing their thing and cause incredible damage.
Yeah. Okay. Let's get to our Q&A.
Oh, heavy, huh?
Yeah. Well, my doorbell's going. 1 second. Can you read that one, Matt?
Yep, I'll read it.
Okay.
So the Q&A, sex addict speaking. D-Day was 50 days ago, and I feel like she has been willing me to leave, as she says she cannot, despite her therapist telling her that she has her own decision to make. So she feels like she can't make the decision for herself, so it feels like she's telling you to go. She has even threatened to expose me to friends and family of being a sex addict and things that I've done if I don't leave. I do believe she can do it. It's a very stressful situation because I want to stay. But then she says things like this. Any advice would appreciate it. Okay, so let's start to break this down a bit. So basically, you feel like she's telling you you need to leave because she doesn't have the ability within herself to make that decision. Well, I mean, if that is old, so it's tough. Are you reading into that, or is that what she's telling you? Because that might be her telling you that she's done. Um, Now, it's tough because you have to decide as a partner that how far am I willing to go in an effort to stay in this. So it's tough because I kind of, the way I say it is like when you're looking at how a relationship works, oftentimes we're pushing or we're pulling the other person in, even if it doesn't look like it. So if I reach out to Scott and I tell him, hey, Scott, I'm really frustrated. You aren't responding to me. Why do you always ghost me? Right? If I were to say that to him, it sounds like I'm criticizing him, but I'm actually trying to pull him close. And so a lot of times we see these behaviors occurring and we have to look, is this her trying to keep an attachment, or is she actually pushing it away? And I guess what's difficult is I can't totally tell if she's actually telling you that, because I hear her saying she's even threatened to expose me to friends and family. Well, part of me says, what would it look like for you to open yourself up to friends and family and to, in essence, expose yourself in a healthy way and let them know, hey, I've screwed up. I screwed up. I've been struggling with a sex addiction. I'm just now learning about it. I'm working with a therapist. I've got a long road to go, and she's really hurt. And so she's lashing out. And so if she talks to you about it, I want to be open so that she doesn't feel restricted. She can talk about it if she needs to talk about it. Now, that may be her trying to tell you she just feels really alone and has no one to talk to, right? So you opening up to people in a healthy way might be very beneficial to the relationship, whether you guys stay together or not. Might be really beneficial to you. Now, obviously, we don't want to go disclose to people um, who aren't healthy, if that makes sense. And I know it's really scary and really embarrassing for someone to go disclose, but one of the best things we can do in recovery work is to come out of hiding and stop isolating. Let's see. So, as far as believing she can do it, that's fantastic. I'm glad you have a lot of hope for her. It's just tough because I think that you learning to be transparent may be really beneficial for her. Um, and you might need to look and see any of these other threats that she's saying. Is that her saying, I'm lonely? I need more connection. And if so, how can you assist in that? So those are just a few quick thoughts. And if I'm hitting it in the wrong direction, throw me another question.
Well, let me ask you this one. I mean, discovery was 50 days ago, so this is very early
Oh, this is fresh.
in the process. Yeah, this is really, really fresh. I'm hoping that you, the addict who asked this question, are seeing a certified sex addiction therapist, and that maybe you and your partner, wife, I'm guessing, are talking about maybe couples counseling or something that can help you work through this. But I lost my train of thought. It's one of these days. I know what I wanted to ask you, Matt, was would if you were like the couples counselor and he wants to stay together but she's not sure, would you recommend a trial separation, a therapeutic separation? What does that look like? How does that work? And what are the benefits versus costs to a couple?
Well, it's really tough because, again, I struggle to say, okay, let's do a therapeutic separation, because if she's not asking for it, I wouldn't go try to solve her problem, right? Like it's a tough one because I haven't, as I'm reading the question, I'm trying to figure out if this is what she's actually sharing or if this is really your fear internally. And so you're putting this on her and then trying to solve the problem that you've actually created in your mind, if that makes any sense. So I would have a hard time. I might say to her, hey, I'm not sure if that you need space. If you do, if you choose to divorce me, I understand. I understand in that it'll be painful and I don't want it. But if you need a therapeutic separation, I'd be willing to explore that as well. But I would go to her and say, here's what I'm open to. Why don't you and your therapist figure it out and come back to me with the specifics, and let's explore that together. But I would be careful to try and solve the problem before you know what it is.
The other thing I wanted to bring up, and this is one of the things that Dr. Rob, I think, would say if he was here, is, and this is geared more toward the betrayed partner, is try not to be vindictive with sharing information.
Oh, for sure.
Because anything you say to family, especially to kids or your mom or your sister or whatever, can't be unsaid. And they're going to take your side, and they're going to take your side forever. And if you decide to continue with the relationship and rebuild it, you and your partner can rebuild a relationship that's better than ever. But then you've still got your kids who know this information and heard it in an angry way and took it that way, and your sister and your mom, and they're going to always have a resentment against your partner who you've gotten over the resentment with. So it's always, be careful what you say, because once it's out, it's out.
Right. You can't take it back. And so we have to be very careful about how we do disclosure. Um, and I think sometimes it's be careful what you say because they're always going to take your side, or it may give them more reason to take the other person's side because they might get a sense that that you are being vindictive, right? So that's kind of a scary piece about exposing a partner. You want to work together on what transparency with family and friends is actually going to look like, um, because you
Yeah,
don't
you
want
have a right to get support from your family and friends. It's just a matter of how you go about it.
well, and I've had sex addicted, or people who struggle with sex addiction, right? I've had them come to me saying, I want to tell everybody and get it out there, but my spouse says I can't tell anybody because he or she's embarrassed and doesn't want, the people to blame them or whatever. And so I think really exposing your partner is in some sense exposing parts of yourself, and so working together on what disclosure looks like to other people I think is pretty important. Can I comment because there's another comment in the Q&A about that is from the same person?
Okay.
um, she has verbally said to me that she cannot leave and wants me to make the decision. My response there is, then make your decision. And if you want to stay in the marriage, stay in the marriage. And she will have to make the decision. And it may take a lot of strength on her part to make that decision. I mean, that my instinct says, well, then make your decision for yourself. If you are done and need to move on, you certainly could make that decision, but don't make the decision for her. Make your decision for you, because you have to live with the choices you make, just like you have to live with the choices you've made and the mistakes you've made, and you've got to learn to heal and be accountable for those. You don't want to have to leave her because that's what she's telling you, but it's not what you want, and then have to deal with that unhealthy choice.
Now, Matt, if you were counseling the betrayed partner and she said, I can't make the decision, I'm going to force him to make the decision, what would your advice to the betrayed partner be?
I would tell the betrayed partner, I'm really worried. I'm worried because one, I'd spend a lot of time asking questions like, help me understand why you can't make that decision. What about making that decision seem so scary, so painful? Um, and why is it that you would, in essence, so a lot of times a betrayed partner will say, I feel so powerless. Well, help me understand why you're giving away one more piece of power, right? And by power, I don't even mean like a dominance thing. I mean like the ability of self to make a decision for self. Like, what's going on there that you don't want to make that decision? What are you afraid of? That it might be the wrong decision, and so you don't have to take accountability? That it might be the right decision and you don't have to take accountability? Like, what's going on there that you don't want to make that decision for yourself? Now, I would also give lots of compassion and empathy that, you're in so much pain. Maybe making this decision right now isn't. Maybe it's not the best time to make this decision. I've often told people that if you, I will tell people, kind of just counsel them, try to do recovery for a year before you make any major life decisions, because let's get you stable so that you're not making really important decisions from a very painful, unstable place. Now, that, I think, advice varies from circumstance to circumstance, but that's kind of a blanket counsel that I will encourage people to consider, because I want them to be as stable as possible before they make a major life decision that that's there for them.
Yeah, Michelle Mays, who works primarily with betrayed partners, talks about helping betrayed partners find their voice. And
Hmm.
that means, helping betrayed partners, know the truth, accept the truth, process the truth, and speak the truth. And, it's a process. And she kind of echoes a lot of what you said about let's not make any major decisions until we find our voice, which is generally 6 months to a year. The addict is finding his footing, which is 6 months to a year. The betrayed partner is also finding her footing. And I'm being sexist here with him and her, but it just takes a while, and
Right.
it's good to not make momentous life decisions in that time frame.
Absolutely. Now, I think it's okay if it's like, hey, look, I'm not able to stay stable enough that I need to do a therapeutic separation, right? Okay, if that's a decision that you can make with your therapist, but that's you having a voice.
Yeah.
That's you making a choice. And yeah, absolutely. Every one of us needs to learn to have a voice. Um, and learn to share that voice and ultimately own our own choices. It's hard though.
Yeah. Yeah. Okay. Let's go into another question here. If someone continuously has extreme reactions in conflict, are they capable of recognizing that they can see the situation any other way? How can someone be mindful enough in that moment to consider someone else's point of view? Is there a trick to reality testing in the moment of conflict? Good question.
This is a wonderful question. So you use the word continuously has extreme reactions in conflict. Well, are they capable of recognizing they could see any other way? And my challenge to that is, or the idea, or the answer to that is, in the moment of extreme conflict, no, they're not capable, right? And because they aren't practiced, right? They've developed a neural pathway in their brain that goes to that one place every time. Now, one of the reasons we do therapy is to gain self-awareness. And when we gain self-awareness, we gain a sense of presence, and we stay tuned into the moment, and then we can learn to choose our reactions in the moments of extreme conflict. Now, does that take a lot of work? Yes, it does. It's really, really hard to learn how to do, but lots of things are really hard to learn how to do. And so if you want to have healthy and happy relationships, then you got to put in the fight and learn how to do this. I love how you said, can someone be mindful enough in that moment to consider someone else's point of view? The very simple answer to that is yes, they can be mindful enough, but mindfulness takes hard work and practice. You kind of hear someone say, the moment you think you're mindful, you're probably not mindful, right? Like you're not being present. So mindfulness is I think, a constant study, a constant practice for every single person. I've been lately enjoying Teach Not Han's book. I think that's how you say it. I Am Here, or You Are Here. I think it's called You Are Here. And he talks a lot about learning to be present, learning to be here where you are, not distracted. Well, if you're talking about somebody with a sex addiction or a drug addiction or any type of addiction for that matter, they are never here. They are there, and they are trying to figure out some way how to get out of their reality. So some of the least compassionate, least empathetic people are going to be people who numb out in their life because they don't know how to be present. They don't know how to be here in their emotions, in their pain. The way that we learn to be compassionate and empathetic to other people is that we have to find that place within us that can understand that place within them. And in order to do that, you have to learn to be very present. So your question's beautiful because it's all about mindfulness. Is there a trick? No, there's no trick, right? A trick implies and I'm reading into your statement. A trick implies this, quick and easy method. No, there's no trick. It takes practice. And Thich Nhat Hanh, one of the things I love about him is he starts out just saying, notice your breath. We breathe involuntarily. And he one of the things I love about it, I think it's chapter 1 of that book. I think he starts off right away really saying, notice your breath. And if it's shallow, let it be shallow. If it's heavy, let it be heavy. If it's loud, let it be loud, right? Just let your breath be what it is and learn to be at peace with where it's at. I think if there's a trick, it's starting with the involuntary nature of our bodies, learning to accept our breathing and let it be. And as we learn to accept and be present with our breath, we can learn to accept and be present with lots of other parts that are going on for us.
And I just want to add that, I mean, I've been working on this exact thing for almost 20 years in recovery, and I've gotten much better at it. But, this was a couple of months ago, and I was talking to someone, and he was trying to mediate between someone else and me. And it was an issue that I thought was long gone. And he brought it up. And this is not the person I'm mad at that I'm talking to. And I went off. I just went off. And he said, okay, can we stop and pause and take a deep breath? And my answer was no. I am too angry. No, I want to be angry. So we had to table it and pick the conversation up later that day. Because he had enough skill to say, well, then we're going to discuss it later. Because I'm not going to sit here and listen to you rant for the next half hour, which is what I wanted to do. And I was, by later in the day, I was a little embarrassed, but, because I know that's not good behavior for me. But, in the moment, it just hit a nerve, it pushed a button, and it was one of my big buttons, and I went off, despite 20 years of work on this very thing. So yeah.
Absolutely.
All right. Let's go on. I've been with my sex addicted partners 5+ years, long distance with an international border between us. Discovery was over a year ago. I'm at a point where I can no longer be long distance and not get specialized sex addiction relationship help. He and I have now broken up over the phone because he was unable to meet my needs. My question is, what is the best strategy to navigate forward in a loving way? There's no contact since I set my boundaries, and he has been unable to meet them. So this is actually, how do you navigate a breakup in a healthy way?
Well, it's interesting because you say, my question is, what is the best strategy to navigate forward in a loving way? And if you guys aren't together, then I'm going to assume what you're asking is, how do I maintain love in my heart for this person, love in my heart for myself, as a way of letting go and being at peace. I mean, that unless I'm off, I'm not, because it's ultimately, if I'm hearing it, how do I move forward maintaining a loving self? And I mean, it's gonna take you going into the pain and learning to love the parts of yourself that maybe made mistakes, or the parts of yourself that got hurt. A lot of times partners feel like they should have known better, or they should have seen something before it happened, and that it's their fault that this happened. Or if one thing I hear a lot is, if I had been a better partner, this addiction wouldn't have happened. And that is just not true. And so I think, unless I'm misunderstanding the question, there's a lot of self-compassion. And I think much of what we've been talking about is compassion towards him. Yeah, you said he and I. So compassion towards him, and and having love and care for him, even if getting together would never be a healthy thing. And so that's just almost like learning to send out good karma and let that relationship go, wishing the best, not engaging in Schadenfreude or however it's pronounced. Um, so I don't know if that answers the question, but that's kind of the only way I know how to read it.
That was kind of how I read it too. I mean, a really loving thing is to keep your boundaries. It's loving
Yeah.
to you, it's loving to him. Keep your boundaries.
Loving to
Set
yourself
those
and love.
boundaries for a reason.
Yeah, I try to tell, one of the things I teach people is that the most loving relationships you have the most boundaries. And people often get confused. They think, no, the best relationships, the safest relationships are the ones where there's no boundaries. And
Ah,
I'm like, no way. Because the people who know me the most, the people who love me the most, and the people who I know the most and love the most, I am so familiar with their boundaries, and I'm respecting them. And so the people I love the most, I want to know more and more and more about what their boundaries are, because then it enables me to love them more deeply. And so the more boundaries a person has, the more I'm able to love them the way they're wanting to be loved. So absolutely, Scott, I love that you bring that up.
okay, so the next one here, and it's kind of two parts to the question. If you have PT and are triggered, it's a deal changer. Just can't unlearn that
I think
EMDR neuropathy.
this one's responding to where I said learn to be present in it, and
Yeah, yeah,
I think it's a great question. So go ahead, I'll let you finish it.
yeah. It's basically about it's about PTSD, and this is referring to the partner of the addict, but I think it goes just as well for the addict. And this is a situation I just described for me. A couple of months ago, is somebody pushed one of my PTSD buttons, and I do have PTSD, and boom, and it was a that's a deal changer, and it is, and it's really. So what can you do when you have PTSD and one of your buttons gets pushed?
Yeah, so I actually love that this question was posed, and what's being said basically is if you have PTSD, you can't just unlearn it and be present because it's PTSD, right? Well, my challenge to that is, well, one, you're absolutely correct. It is PTSD, and PTSD has um, essentially uncontrollable responses that are occurring as a way of survival, right? So it's not any different I've been talking about. Now, the truth is you can unlearn it. Now, by unlearn it, you mentioned some great ways: EMDR, neurofeedback, neurotherapy, I guess is what you said. So, but like there's trauma modalities that help us to unlearn our conditioned responses and help us um, to get present so that I'm not reliving that past trauma over and over and over again. And that's the point of those modalities. Now, what those modalities are doing is that you have somebody who's trained in a very specific way to work on teaching the brain to unlearn those experiences, to lessen the intensity so that that person can learn to stay in the present, honor the trauma, and heal and move forward. And so my challenge there is, if it sounds like I'm saying it should be easy to unlearn, I'm not suggesting that at all. Sometimes it takes years of therapy to unlearn a conditioned PTSD response. And I would never minimize that. As an individual who experiences PTSD, I mean, there are physiological responses that I have that still happen to this day. But what I've learned for myself and others, we have to learn to unlearn those through different modalities, different methods. And yeah, I would never say to somebody, hey, I know you have this trauma, but just learn to pay attention to your breath. and you'll be fine, right? It's like, no, I don't think it's that easy. Sometimes it takes multiple modalities and therapies to figure out how to unlearn that. So I love that you brought that up, because I would never want to minimize that. And I think that's maybe what came up there.
Yeah. Thank you, Matt. Hi, thanks for holding this webinar. I am a sex addict who was recently discovered by my wife 2 months ago. I'm seeing a CSAT, good for you, doing 12-step SAA and group therapy work, yay. We are connecting greatly when we share with each other, but I'm still struggling with being 100% honest with her questions when she is struggling and in her fetus cycle, because I struggle holding her pain when she is very angry. I have done serial disclosure with her, so we have set up boundaries, but we are struggling with that. I went to live with rigid honesty, respect our disclosure boundaries, and be there to hold her pain. We are planning on doing full disclosure with my CSAT. I don't know when this will be, though. What are some tips for being honest while holding this boundary? I tell her when I've had a slip, but share no details until I talk to my CSAT and then get back to my wife on the details within 24 hours. So, first of all, partial disclosures over and over, death by paper cut. Ouch, 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 ouch. Nobody wants that. So I'm glad you're holding some boundaries, and now I'm going to let Matt talk.
Well, so I'm trying to figure out what the question is, because it's really like I'm hearing basically there's been a lot of messy, unhealthy disclosures, but that you guys are working through it. So good for you guys. You want to live with rigid honesty. Well, to be honest, learning to live with rigid honesty is so difficult for somebody who has had to learn to lie to survive. And I think it's awesome that you're trying to figure out what's okay to share, what's not okay to share. Ultimately, that comes down, I think you said her, yep, wife. That comes down to her, that it's her choice. And her and her therapist will ultimately decide what gets disclosed, and if that makes sense.
And I think the question is about, they've agreed that they're going to do the full disclosure. You know, I always tell guys that the response is, yes, I promise I will tell you everything when we do full disclosure on this date. Until then, can we table, you know, I know you have questions. Let's save them for disclosure. Let's do it in a therapeutic session where we both have support, so that I don't cause this ongoing pain where you don't have support. I think that's, how do you hold that boundary? I think that was how I was reading the question part of this.
How do you hold the boundary when you don't?
When you're planning to do a full therapeutic disclosure, how do you avoid doing death by paper cut disclosure along the way?
Right. And I think the way you're doing it, what I heard there is, it tends to be the most effective. I'm going to disclose to you any current slips that happen. Now, I tell people you have 12 hours to let your spouse know that you had a slip. And you have to let them know. You can't just say, hey, I slipped. You have to say, hey, I slipped 3 times in the last 12 hours, right? Because sometimes people make the mistake and they're like, oh, I just need to report slips. Okay. They slip once, then they slip 5 times, and then they report 1 slip. That's not okay. You need to say, hey, I went back and I slipped 3 different times, or whatever it is, right? But you have 12 hours to report it, and you need to be honest about how many that there were. And as far as what details to share, I mean, we're talking sex addiction here. Again, some of that is up to the partner, and essentially the partner and their therapist. But I say that you share. I looked at porn 3 times and I masturbated twice, or whatever it is, right? And now, what you don't typically want to get into, unless there's a therapeutic reason, and again, this is, I can't emphasize this enough, this is up to the partner and their therapist to determine what is disclosed. But I wouldn't get into the details about what type of porn or something like that, right? Now, if that's disclosed in the full disclosure or asked about in the full disclosure, then we can talk about that at that time. But while you're waiting and preparing your disclosure, you're going to want to stay current on what present day slips are looking like, and you want to be honest about what they are, frequency, that sort of thing, while you're preparing for disclosure. So that answer the question, Scott?
Yeah, I think so. And maybe just to clarify it a little bit, if the wife or betrayed partner asks questions about something that happened 2 years ago, that's the kind of thing that should be put off until therapeutic disclosure.
Right.
You're saying current stuff that happens, you need to disclose.
Current stuff. If a spouse asks that, I would say I'm actually going to be answering that question in the full disclosure. I'm so glad you asked. You have every right to know. I believe we've been instructed that we're going to share all of that in the formal disclosure. And so thank you for letting me know that's a question you want answered. If you and your therapist decide that needs to be answered sooner, let me and my therapist know, and we can figure out a way to do that. But the mistake I see a lot of spouses do is they will not partners, but people struggling with the addiction. What I'll see them do is, well, I'm not supposed to tell it, so I'm not going to say. And it's like, stop trying to stop trying to use the excuse that I was told that I'm not supposed to share this to withhold information. You need to put it back on the partner and say, I will share that and I will answer any question. However, I need you to talk to your therapist, and I want to make sure we do it the right way. Right? Do not take into your own hands what should be disclosed or not disclosed because of what you've read or what you've heard or what you think you've heard. You always affirm to your partner that they have a right to know everything, and that from your understanding, now's not the right time, and you will answer it as directed from your therapist. So does that make sense?
And from your therapist's plural. Yeah, like her therapist and your therapist. And this next question goes right to that. Do you have any suggestions on how to manage the stress, anxiety, and other feelings during the period of time between when disclosure is scheduled and when it takes place? So I know disclosure is coming a month from now. How do I deal for this next month?
I mean, all that stress and anxiety leading up to be honest, it is the worst experience, I think, for both people. And then oftentimes after the disclosure is over, the person struggling with addiction like feels this huge weight off their chest, and the betrayed partner then is kind of like, okay, now I'm dealing with all this information, and so it's doubly difficult for the betrayed partner, is what it feels like everything is in this process. But the best thing to do in that waiting period often is, of course, journaling, because you're having a million thoughts go through your head, reaching out to your support group, talking through the journaling with your support group, attending your therapy sessions regularly. Oftentimes there's so much stress and anxiety, you probably need at least once a week. Sometimes consult with your therapist on this, but you might need more than once a week leading up to. It's doing your dailies, taking care of your physical needs, emotional needs, relational needs, spiritual needs, staying in balance with those things. It's really basic recovery stuff that is not easy. It's not basic, right? You're learning it all new in recovery, but all of that, staying balanced and processing through things, honoring that you're in a rough place, feeling the pain, sharing it with others, All of those things are what you need to be doing. If I don't necessarily have any specific thing that's going to be like, wow, what we know is between the time period, this really helps a betrayed partner. Like, I don't have anything that really jumps out to me like that. Other than, honestly, be patient with yourself. It's a scary thing to wait for, and it's a scary thing to have happen, and there's a lot of pain afterwards. So be patient with yourself as you're stressed and waiting for another blow.
Yeah, the one thing I would say is don't catastrophize during this time period. Addicts tend to do worst case scenarios in their head. If I tell her everything, and I'm going to because I promised to, and then I'm going to take the lie detector test or whatever, she's gonna leave me. She's never. And betrayed partners, I think, also tend to do worst case scenario. Well, I know that he did this, so they just take it and run with it, and
I think
and
we all tend to catastrophize,
invent
right?
100 scenarios that didn't happen.
Yeah. No, I think generally, I think it kind of is human nature that we have to learn not to do is we have to learn to not catastrophize, right? We have to learn to not go worst case scenario. I once heard somebody say, you can't tell me that worrying doesn't work, because all the things I've worried about have never happened, or something silly like that, right?
Yeah.
And the reality of it is that we're trying to gain control by catastrophizing, because if I can prepare for a catastrophe, then the catastrophe itself won't be so bad. And although I think it's important to prepare in life, catastrophizing can just be a whole nother mess of anxiety we don't need. And so I think checking in those big heavy catastrophe thoughts with other people is really important, keeping those in check.
And I think the other thing to keep in mind is if it's clear that you are both committed to healing the relationship, therapeutic disclosure, as difficult as it is the first major step toward healing the relationship. That's when the relationship, once the truth is out, the relationship can heal. You have a baseline to rebuild. So if you look at it that way, it's still not a fun process for either of you, but it could be the springboard to a better relationship, and that's why you're doing it.
For sure.
Okay.
I mean,
I thought
honestly,
you were going to have more.
it's well said. I don't know what else I have there.
So, okay, everybody, we are out of time, and we got through all of our questions. We timed it really well today. Thank you.
Seriously, good job, guys. Go team.
Yeah. So we'll be back in 2 weeks. And reach out to Seeking Integrity, sexandrelationshiphealing.com if you have questions in the interim. If you have questions for Matt, I'll forward them to him. And
please do.
Yeah, we'll see you in a couple of weeks.
All
Thanks,
right,
everybody.
I'm excited to see you guys. Thanks for the good work today.
Thanks, Matt. We'll see you.
Yep, see ya.